So our next presenter is going to be OnceLogix, which is a tenant in the Piedmont Triad Research Park. The company is a solutions provider that specializes in developing custom, enterprise-level, and web-based applications. Rod Brown, the Chief Operations Officer, is here to speak about how its ShareNote product can improve the behavioral health industry. Rod, come on up.
Thank you, and good morning. Okay, hi, my name is Rod, and I'm happy to be here with you to share how our company, OnceLogix, and our product, ShareNote.com, is helping the behavioral healthcare industry save time, save money, and also improve their overall business processes. Over the next few minutes, I'll discuss the problems of the industry, how we've solved some of those problems, and how we've monetized the software as a service. OnceLogix is 6 years old. We're headquartered here in Winston-Salem, North Carolina, and we also have offices in Atlanta, Georgia. We create web-based enterprise solutions for the automobile, trucking, education, sports, healthcare, and clinical trials industries, just to name a few. Today I'm here to talk about ShareNote, which is our flagship software as a service product. ShareNote is a practice management tool used by individuals and businesses that provide mental health services and substance abuse services like counseling, psychiatric therapy, medication management, and psychiatric evaluations. I want to talk about some of the problems of those industries. We solve several of their problems for this niche market. A great deal of mental health care agencies across the country provides services for local, state, and federal government, and its clients, which happens to be the general public that typically doesn't have access to mental health or substance abuse services. Mistakes in this highly regulated industry are very, very costly. Companies that use ShareNote are audited in several areas of their practice, like billing and program integrity, and ShareNote pretty much eliminates the opportunity in several areas for audit deficiencies. ShareNote also shapes and creates workflow and improves the processes for these industries, which ultimately reduces the overhead for them and saves them a ton of money. ShareNote helps prevent fraud activities that not only cost agencies money, but could land management staff in prison. Let's talk a little bit about the solutions that we provide. Within 48 hours of agreeing to use our system, the customer's profile is built and training is scheduled. Without any startup costs or any maintenance fees, the user can begin entering staff and patient information inside of the system immediately. The next step is usually uploading patient chart information and staff credentialing and training information into the respective profiles. The system remains current with all regulatory requirements. Other enhancements and updates are usually requests of ShareNote users. ShareNote.com then begins to manage the client's data, their documentation, and also improves communication within the organization. All the information gathered for the patient, from general information like name, address, social security number, to more critical information like their diagnosis and medications, are stored inside of the system. Any physical documentation like progress notes, psychiatric evaluations, healthcare consent forms, those type things can actually be scanned and uploaded into the system. ShareNote then becomes a key part of the agency's disaster recovery plan. Contact logs, schedulers, calendars, auto emails, and text messaging connects the staff and also gets critical information to key people inside of the organization pretty quickly. I want to talk about some of the advantages that we have. ShareNote provides OnceLogix with several business advantages. Maintenance is relatively inexpensive. Whenever we make a change for one client, everyone experiences that change, and they experience that change pretty immediately. Pricing is very, very simple. Users, they pay a monthly license fee. Our revenue is fairly predictable because of the recurring revenue model that we have in place. This allows us to focus more on client relations and marketing to increase that recurring revenue. We have a little bit of proof in our model. ShareNote has evolved into an electronic or electronic medical record system specifically for the behavioral health care industry. Users making functionality enhancement recommendations has totaled into the thousands. We make about 10 to 20 updates every single month, and because our users have acted like our research department, we typically don't charge for the updates that we make. The behavioral health care industry is a tight-knit fraternity, and very little money has been spent on advertising to find users. And trade shows, conferences, and word of mouth has allowed us to secure over 30,000 individual users of this system. Mobile is definitely in our near future. Although you can log on to ShareNote and it can be accessed with a mobile device via the web, iPhone, iPad, Droid will soon have native platforms or native applications for ShareNote.com. The services that our user provide, those services are the same across state lines and even internationally. So we primarily focus in the Southeast just because we're here. We plan on going public or some type of private placement. That's in the near future in our strategic plan in a couple of years. And we're excited about being in this community and being in this environment where technology is so prevalent. And that's all I have. Thank you.